Today's topic is medical disorders complicating pregnancy. So in this we include hypertensive disorders, then diabetes, hematological disorder, that is the mainly commonest hematological disorder or the commonest medical disorder in pregnancy is anemia. Then cardiac disorders. Besides there are immunological disorders, liver and renal dysfunction, maternal infection. So first of all we'll deal with hypertensive disorders. What's the definition of hypertension in pregnancy? A systolic BP more than 140/90 and a diastolic BP more than 90 millimeters of mercury. It should be documented on 2 occasions at least 6 hours apart. How will you classify? There are 5 groups. One is gestational hypertension. The second is preeclampsia. Then eclampsia. Then chronic hypertension. Then preeclampsia superimposed on chronic hypertension. What is gestational hypertension? BP more than 140/90 after 20 weeks of pregnancy or after delivery, and it resolves by 12 weeks postpartum. And there should not be any proteinuria, and the final diagnosis can be made only in the postpartum period. If it is resolving immediately, then it is not gestational hypertension. It is gestational hypertension. Preeclampsia, its definition is new onset hypertension after 20 weeks of gestation along with properly documented proteinuria followed by return of BP to normal within 12 weeks postpartum. And nowadays, proteinuria is not needed for the diagnosis of preeclampsia. Hypertension with other factors which showing the severity will also be grouped under preeclampsia. Whenever there is hypertension plus proteinuria, it is preeclampsia. The third is eclampsia. That is a patient with a preeclampsia, that is hypertension plus proteinuria, is developing seizures not attributable to any other cause, followed by coma. Then the fourth is chronic hypertension. Here the patient will be having hypertension even before pregnancy, or hypertension is diagnosed before the 20 weeks of pregnancy, not due to gestational trophoblastic disease. And the third is hypertension diagnosed after 20 weeks, but the BP is persisting even after 12 weeks postpartum. Then the fifth is superimposed preeclampsia. That is a patient is a non-case of chronic hypertension. She is developing proteinuria, a new onset proteinuria, where there was no proteinuria before. Or a patient who was having proteinuria now showing a sudden increase in protein level or a sudden increase in BP. All this will come under superimposed preeclampsia. So the commonest among this is preeclampsia. So there is hypertension plus proteinuria, and we quantify the proteinuria as proteinuria when exceeds 24-hour urine protein exceeds 300 milligram or 1+ on dipstick in a random urine sample, or a urine protein by creatinine ratio more than 0.